When I started early in the early 70s, the evolution was not there of the plastic surgery. The technology wasn't there. And it was primarily focused early on in cancer surgery, reconstructive surgery after cancer. And so I did a lot of cancer work early on. And then in 1979, I did a fellowship with Howard Gordon and Tom Baker, who are the best cosmetic plastic surgeons at the time on the planet in Miami. And from there, I began focusing more and more on just cosmetic surgery. Since in the last 5 years, women are coming in now for the Brazilian butt lift, where we transfer fat, we do liposuction, liposculpture, you know, to mainly the abdomen, giving them great curves, giving them a good look, but then taking that fat and putting it into the butt. And women go crazy, and they just line up for this all the time. We're doing a lot of them. By the way, we're also on Snapchat, so people can actually watch us doing these surgeries. Well, we do a lot of tummy tucks, mommy makeovers, which include the tummy tuck and the breast implant surgery. We do breast lifting. We do, again, liposuction, as I mentioned, with the Brazilian butt. I love doing noses, rhinoplasty, eyelid surgery, facelifts, and so we're doing full body, including head and neck, cosmetic surgery. And now we're also, in terms of the newer technologies coming on board, we're doing a lot of stem cell, PRP to the face and to the body. And so we're rejuvenating the face, we're rejuvenating the skin, we're rejuvenating tissues with stem cells, and replacing a lot of the fillers with the fat, the stem cells from fat, with platelet-rich plasma. And I'm sure you've heard of, for instance, the vampire facelift, where instead of cutting and we're lifting, rather than doing a facelift, we're calling it a space lift, because with aging, you lose volume. And when you're filling up the face with volume, you're rejuvenating the face, and so I can get rid of the jowls, the lines, and make the patient look younger.
Do you have for new patients?
I think that patients intuitively know what they would like to have done. And insofar as due diligence, I think that one, as I mentioned earlier, thing is to watch us on Snapchat, look at our Instagram live, Instagram pages, and see our work as we're doing it. I've been doing this now for 47 years, and in terms of technique and that, we're solid. We do great work, and that's basically what you want to find: a very seasoned, very experienced cosmetic surgeon, and that's what I do. The board certification in plastic surgery, and there's also the board certification in cosmetic surgery. Plastic surgeons typically, after doing a period of general surgery, which is gallbladders and appendixes, and doing just general work, they go in typically to a 2-year residency in plastics, in which they're in a county hospital typically, where they're doing burns, car accidents, gunshot wounds. And nobody comes into an emergency room at 4 o'clock in the morning for an emergency breast implant. So when they get out of their 2 years of training, they then go to doctor's office and watch a few cases, and then they say, you know, I'm board certified plastic surgeon and I'm the best, and nobody else can do this work but me. And then there's me, who's been doing this for 47 years. I've had a lot of fellowship training. I'm board certified in various specialties. The point is that a plastic surgeon really does not get in his training, cosmetic training, adequate amount of training to say that he's the only one who should be doing it, because it's not true. And they've made this almost a religion. They've really promoted themselves with advertising that they're the best, they're the only ones who should be doing this. And really, I've had a fellowship program where I was training doctors through the American Academy of Cosmetic Surgery. I've been doing it for 10 years, and I've trained a lot of people in cosmetic surgery. And during the time, in the last 25 years, I've had many plastic surgeons, board certified plastic surgeons working here, and then cosmetic surgeons. And by far, the cosmetic surgeons were much better, well-trained, better in doing cosmetic surgery than the plastic surgeons. I mean, I had a board certified plastic surgeon here who I was afraid to give him like a breast lift because he would lose the nipple. And I had to get rid of him because they are very rigid in their thinking. They feel like they're the best and nobody can tell them what to do. And so we had a problem. And the problem has been consistent within the plastic. When I get plastic surgeons in here, they're not as competent or capable, in my experience, in my judgment, in cosmetic surgery as the, quote, board-certified plastic surgeon is. Board-certified plastic surgeons are great if they're going to do flaps for cancer reconstruction and that kind of thing, but insofar as cosmetic surgery, the residency does not give them the qualifications to do cosmetic surgery to the point where they can come out and say they do it better than anybody else, because that's a lie and it's not true. And it's just based on political and economic reasons that they do this.